As we promised, we have come back with white blood cells, the so-called leukocytes. This is our topic today. Now, the leukocytes, the normal range for the leukocytes, it's 4 to 11 times 10 the power 9 cells per liter. But this sometimes differs depending on the activities you are doing and the state of the day. There are certain conditions that may lead to the difference in this normal range. But that is the what? That's the normal range. Let us look at the different types of the leukocytes. We have here leukocytes. Leukocyte types. So, the leukocytes we have here, the leukocytes are majorly of two types. We have majorly two types of leukocytes. One, we have what we call the granulocytes. And agranulocytes. They are sometimes called, these ones are sometimes called polymorphonuclear cells. Then these ones are sometimes called mononuclear cells. So these ones, they have granules. That's why they are called granulocytes. The other ones, they don't have granules. That's why they are called agranulocytes. But it's not that they really don't have granules, these ones. They have non-specific granules, but these ones have specific granules. That's what they are called granules. The other ones, they don't have specific granules. So here let us start to see the different types, because these ones they are further divided into three components. Further divided into three types, subtypes also. These ones are also divided, but these ones are divided into two subtypes. These ones, the first type here is the neutrophil. Another one is the eosinophil. Another one is the basophil. So that is with the granulocytes. They have three types. Now we have the agranulocytes. These ones are divided into monocytes and lymphocytes. The lymphocytes are also further divided. But let us first see, because they are further divided into the T lymphocytes and the B lymphocytes. They are further divided into the B. This is the T and the B lymphocytes. Lymphocyte and the B lymphocyte. Now, let us look at their morphology. The appearance, their appearances. This is how they do appear. This is how they do appear. The neutrophils, the neutrophils, they appear somehow like this. The eosinophils, they have somebody putting on spectacles inside their cytoplasm. They are like somebody is putting on spectacles. The basophils, this is the basophil. Then we have the monocyte. The monocyte is like somebody who got lost in the moon there, like a baby in the womb. The nucleus here. Then the lymphocytes, much of the inside is covered by the nucleus. Much of the inside is covered by the nucleus. So that's their structure morphology. That's their structure morphology. Now let's look at the staining characteristics of the granules. The granules inside. Now here, they have the difference in this on the side of the leukocytes. I mean the sides of these agranulocytes or the polymorphonucleus. We are going to see what differentiates them. Let us start with the basophil. Basophil, they are called basophils because their granules are basophilic. They take up the basophilic color, which is blue, deep blue. Actually, it stains deep blue. So the granules will stain deep blue. When you look into the microscope, you will see these are the granules which will appear. So when we look at that eosinophils, the eosinophils, when you look into their cytoplasm, they contain granules which are eosinophilic. Eosinophils, their granules are eosinophilic. They take up the eosin content that is contained in the Romanovsky stain, which is red or pink, yeah? So this is the staining characteristics of the granules. So when you look at the neutrophils, this neutrophil, it is a neutral. It neither go to this side or this side. It is a neutral. That's why they are called the neutrophils. So here, their staining characteristics, they have these red staining characteristics. They stain red. They have these granules staining red like the eosinophils. And also they have these blue staining granules. The blue staining granules like the basophils. So it stains like this one, like this. So it is neutral. Does not come to this side or this side. It is neither a neutrophil nor it's neither an eosinophil nor a basophil. So it has granules which are a mixture. That's why they are called neutrophils. Now, we are going to look at their, well, let us first look at the monocyte. Actually, yeah, let us first finish this part. Now, when you look at here the cytoplasm, the cytoplasm nuclear ratio is 1:1. Actually, it's the same here, 1:1, and even here, 1:1. Here, the ratio here, it is either 2:1 or 1:1. Here, the ratio is 4:1. The nuclear ratio is 4:1. This is the nuclear, this is the cytoplasm. The ratio. The normal range here of the neutrophils percentage here, it is 40 to 75%. Here, the percentage here is 1 to 6%. Then the percentage here, should be less than 1%. Here the percentage is 2.0 to 10.0%. Then here it is 20 to 40. It is 20 to 40%. We have the absolute count. Absolute count 2.5 to 7.5 times 10 to the power 9 cells per liter. Then absolute count here is 0.04 to 0.4 times 10 power 9 cells per liter. Absolute count here is between 0.015 to 0.1 times 10 power 9 cells per liter. Then here the absolute count here is 0.2 to 8 cells, 2.8 times 10 power 9 cells per liter. This is between 8 to 16. This one is between 8 to 16. They are all micrometers. This one is between 8 to 14. They are also micrometers. Then this one, the monocyte, is between 16 to 22 micrometers. So the monocyte for it is 8 to 12. So when we look at the lobes, neutrophils, eosinophil, basophils. Now the lobes here, when you look at the lobes here, there are 2 to 5 lobes. Here we have 2 to 5 lobes in the neutrophil. Then in the eosinophils, we have two lobes in a spectacle form. Then here we have a bilobe opposite one. So those are the lobes we are having. Elevation. So elevation comes about in bacterial infection. Bacterial infection, fungal infection, bacterial infection, fungal infection is actually most bacteria like bacteria like the streptococcus, the staphylococcus, all those ones, they lead to the rise of the neutrophils because these ones, they majorly work on those intruders. So here the basophils, they usually go high in allergic reactions. These ones in allergic reactions, they rise in allergies. Then also in the parasitic infections. These monocytes, their elevation will come because of there's inflammation. In the inflammation cases, actually even in the lymphocytes will also rise in inflammation. So in inflammation, we'll lead this one and this one to rise. Chronic, majorly chronic infections. they lead to the rise of the monocytes and the lymphocytes. Basophils, the eosinophils, and the neutrophils. Now these ones, they have the same characteristics right from the beginning. But the granules of the neutrophils, we have the azurophilic granules, or the primary granules. They are azurophilic, or the primary granules. These ones, they appear from the starting of the formation of the cell, the neutrophil cell. They appear from there up to the stage of the so they appear. They start appearing from the time of the formation of the cell up with, but they don't go beyond the promyelocyte stage. After the promyelocyte stage, we have other granules, which are called the specific granules. These specific granules, they appear from after the stage of the promyelocyte 2, and these ones, they are the ones which are mixed up. Some will stain blue, deep blue, and some will stain pink or purple. Then these ones, the primary ones, these granules, the primary granules or the eosinophilic granules, these ones only stain red. Actually, they only stain with the eosine color. Eosine color of the Romanovsky stain. The neutrophils, they die at the site of action. Actually, after they have engulfed, they encounter a pathogen, they engulf it, but after engulfing that antigen or that pathogen, they die. Hence, most cases they lead to formation of the pus. Then, also another thing, you should know that the monocytes, they are not like neutrophils. The monocytes, for them, when they work, they don't die at the point of action. For them, they don't die like the neutrophils die. So next time we are going to talk about the detailed information about the white blood cells. We are going for the detailed information from our next video. We are going to see how blood is formed from start to the end, where it ends. Don't forget to subscribe. Don't forget to like. Comment the question. We shall come here and give you that topic you want in any subject, because we have all those subjects and we have so many sources and many people who are ready to give you the services. So just subscribe, keep tuned, and just give in your question. We are going to give it an answer. Thank you.